So social inequalities have become more visible everywhere the coronavirus pandemic has struck. And that's even more the case in the highly unequal societies of Latin America. These are countries where there are much larger numbers of informal workers who lack labor protections or savings, and who rely entirely on being able to work for their survival on a weekly basis. But there are also distinctly urban dimensions of inequality to do with the way that cities are built and organized in the region. And these have the potential to significantly exacerbate the unequal effects of the pandemic on different groups. In the case of Brazil, Brazil is a highly urbanized society with about 85% of the population living in urban areas. And its largest cities like Sao Paulo and Rio de Janeiro are the places COVID-19 is currently spreading most quickly. There are a number of groups of urban residents in Brazil who are going to be more seriously affected by the pandemic. And one in particular are the many millions of residents of favelas and precarious urban peripheries. So homes in these areas are often overcrowded with multiple generations living under the same roof, which makes isolation of at-risk groups, in particular the elderly, almost impossible. These neighborhoods are often densely constructed and densely populated, which increases the potential spread of the virus. And in more precarious neighborhoods, often there's a lack of basic sanitation, things like running water and sewerage, that makes regular hand washing far more difficult. And then there's also the question that these neighborhoods are often likely to be further or to have more difficult access to the essential services they'll need during this period. Places like supermarkets, pharmacies, banks, and of course, health services, health centers and hospitals. And then finally, there's this the greater livelihood that they'll need to continue working to have any kind of income, which also has an urban dimension in the sense that they'll need to travel, often large distances and usually on public transport, which exposes them to the risk of infection, and as they return to their neighbours, exposes their families and neighbours. So what are the urban politics of COVID-19 in Brazil, and how might they evolve as the crisis deepens? So national politics is currently revolving primarily around the antics of the president, Jair Bolsonaro, who's fighting with his own ministers and downplaying the threat of the virus and basically encouraging people to return to work to reduce its economic impacts. But there's also an important local dimension, which is that the social distancing measures are being imposed at the state or city level by state governors and city mayors. However, these levels of government have limited spending capacity. Meanwhile, the federal government has created a basic income of 600 reais, it's about $120 for informal workers, but this falls far short of what's really needed. It's little more than half the minimum wage and much less than most informal workers would be able to earn in a month. I think a second element of the kind of urban politics of COVID-19 in Brazil is that we need to understand the role that vulnerable urban populations often play in Brazilian politics. And so I think we need to be vigilant of the risk that the feared social, economic and health impacts of the pandemic in favelas and peripheries could generate unrest in these areas and provide opportunities for politicians to pursue these kinds of violent interventions. And finally, what can be done to reduce the negative impacts? There are some really great examples of local mobilization, in particular urban areas, to support those living in the most precarious conditions, and also of larger networks of organizations who are raising funds and coordinating the distribution of food packages and sanitary products and other essential items to those in need. And these networks are also articulating political demands on the state, demanding the state to play a more effective role in response efforts. I think it's essential that civil society and the population as a whole support these efforts with donations and any other kind of help that's possible. However, these are only going to be palliative if there isn't more significant economic support coming from down from the federal government to support social distancing efforts. This is obviously primarily the responsibility of the president and his economic team, and his economics minister, Paulo Guedes, but it's also an argument that needs to be more clearly articulated by the opposition and by society. At the moment, the conflict, fueled by the president's provocations, is essentially revolving around the question of whether or not to retain the restrictions. Whereas in fact, this should be a consensus, and the political debate should be around how much more needs to be spent to actually make them viable.